Know what to expect when having Gamma Knife Radiosurgery. In this video, you will learn about Gamma Knife Radiosurgery. This includes what Gamma Knife Radiosurgery is, how to prepare for your treatment, what happens the day of your treatment, what happens after treatment. What is Gamma Knife Radiosurgery? Gamma Knife Radiosurgery is a type of radiation treatment that is used to treat brain metastases. Gamma knife radiotherapy is like getting an X-ray. It is a painless treatment. There is no cutting or burning. This treatment uses high-energy X-rays to destroy cancer cells. Gamma knife radiosurgery only targets the tumor. This reduces the risk of causing damage to healthy brain tissue. Some gamma knife radiotherapy treatments use a frame and others use a plastic mask. Your doctor will tell you if you will have a frame or frameless treatment. This video is for patients having treatment with the frame. Prepare for your treatment. Planning MRI. Before your treatment, you will have a planning MRI. This may happen on the same day that you are seen in the brain mets clinic or afterwards. After your MRI, your radiation oncologist and the physics team will use these pictures to begin planning your treatment. What happens the day of your treatment? There are a few things to remember the day of your treatment. Eat a light meal in the morning. Take your regular morning medicine. If you take medicine for diabetes, eat before you come to the hospital. If you take your diabetes medicine on an empty stomach, your blood sugar may become very low. Wear comfortable clothing as you may be at the hospital all day. Do not wear any makeup or earrings. This may affect the fit of the frame or mask. A family member or friend should bring you to the hospital. They must drive you home after your treatment. This is because you may need medicines during your treatment that could make you drowsy. It is hard to predict how things will go the day of your treatment. It is best to plan to be at the hospital all day. Since you may be at the hospital all day, bring any medicine you need to take during the day. Keep your medicine in the original bottle. You should also bring a list of all medicine you take. Bring something to eat or drink. Bring something to keep you busy. For example, a book, DVDs, an iPod, MP3 player, or CD to listen to. Gamma Knife Radiosurgery steps. Your treatment will have 4 main parts. 1. Preparing the head frame. 2. CT scan. 3. Treatment planning. And 4. Treatment. Preparing the head frame. The morning of your treatment, your neurosurgeon will attach a frame to your head. The frame is placed using posts and pins that will be adjusted to make sure the frame fits you. You will be given a local anesthetic where the pins are placed. The anesthetic will numb the area where the frame is placed so you don't feel any pain. You may feel some discomfort and pressure when the frame is on your head. The frame will stay on your head until you have finished treatment. This is to keep you in a stable position during imaging and treatment. You will be able to eat when the frame is on your head. You will not be able to wear your glasses. CT scan. Before your treatment, you will have a CT scan. A CT scan takes pictures of your brain and skull. Your doctor needs these pictures to help with the final planning of your treatment. The frame will stay on your head during the CT scan. After your CT scan, you will return to the radiation nursing clinic to wait while your treatment is planned. Treatment planning. Your doctor will use the pictures from your MRI and CT scan to plan your treatment. Your healthcare team will decide which area of your brain to treat and how much radiation to give you. The day of your radiosurgery, there may be other patients also having the same treatment. While you are waiting, you can eat, drink, rest, read a book, or use the washroom. Treatment. You will be taken to the treatment room once planning is complete. Your treatment may take 1 to 3 hours to complete. This depends on the size of your tumor or tumors, the area of your brain to be treated, and the number of tumors you have. Your therapist will tell you how long your treatment will take. In the room, you will lie flat on your back on the treatment table. The head frame will be attached to the Gamma Knife machine. The table will move to place you in the correct position. Gamma Knife radiotherapy is like getting an X-ray. It is a painless treatment. There is no cutting or burning. You may feel some discomfort from lying down for a long period of time. Your radiation therapists will watch you on a camera at all times during your treatment. They will also listen to you through a microphone in the treatment room. During your treatment, you may listen to music, relax, or even sleep. Once your treatment is complete, the frame will be removed. You may have some mild bleeding in the areas where pins were placed. Bandages will be put on these areas. Keep these areas dry for the next 24 hours. This will help prevent infection and allow your skin to heal. Your team will keep an eye on you for 1 hour after your treatment. This is to make sure you do not have a headache when the frame is removed. After an hour, you may go home. What happens after treatment? You'll be able to return to your normal routines after treatment. You may have a mild headache or some swelling where the frame was attached. Take acetaminophen or ibuprofen if you have a headache. The BrainMets Clinic is made up of different healthcare professionals who work together as a team. This includes radiation oncologists, neurosurgeons, nurses, and trainees such as fellows or residents. You may speak with different healthcare professionals each time you visit the clinic. Each of the healthcare professionals will know about your medical history. You will have a follow-up appointment with your doctor and another MRI scan about 3 months after your treatment. You may have side effects after treatment. These may occur after weeks or months. If you have any side effects you think may be related to your treatment, talk to your healthcare team. In this video, you learned about Gamma Knife Radiosurgery. This included what Gamma Knife Radiosurgery is, how to prepare for treatment, what happens the day of your treatment, what happens after treatment.